and welcome to another Chiropractic Care Center video. I'm Dr. Matt Roeder, and here to talk to you about anti-inflammatory measures that you can take besides getting chiropractic care. Now, one of the things that you're going to encounter on a regular basis when you're trying to get over some type of an injury or a subluxation where your spine is out of position is sometimes you'll have this situation where you get to feeling better right after the adjustment, but the pain just keeps coming back. It just keeps coming at you. You get up in the morning, you feel bad, you can work it out a little bit, but by the end of the day you're hurting really bad, and then it's hard to sleep and it's hard to heal and that kind of thing. So I'm going to talk to you about a few things that you can do besides non-steroidal anti-inflammatory drugs like aspirin, extra strength Excedrin, Advil. All of those are NSAIDs or non-steroidal anti-inflammatory drugs, and hey, that's fine if you can take that and you're happy with what you're getting with that. Okay, these are some alternatives, some things that you can try in addition to or instead of. Now, before I embark on talking about all of these things, they're all natural supplements, with the exception of, well, most of this is natural too, but it's also got some other stuff in it, artificial sweeteners and those kind of things. So, but for the most part, all of these things are natural supplements that you can get at the grocery store, health food store, those kind of places, and those will help you to get past some of this stuff. Now, before you take any of this, if you have any concerns whatsoever, if you have some type of food allergy, or you have, for instance, you have problems with hemorrhaging or bleeding too much, you have problems with clotting, you're on Coumadin, those kind of things, you want to clear any use of especially vitamins with for instance the fat soluble vitamins A, D, E, and K. You want to clear that with your medical doctor. Make sure that those aren't going to interfere with any of the medications that you are already on, or if you are allergic to some of these things, then you want to make sure that you're okay with that. Barring those type of circumstances, this is a general discussion on what you can do to try to get this under control. Now, let's start with B6. Now, B6, you can get B6, and that I'm just going to list off some anti-inflammatory these B6 has anti-inflammatory processes, part of the metabolic process. You can go and check that out. I'm going to cite some articles that you might be able to look up on the internet that might clarify some of this a little bit further. I'm not going to go into a whole lot of detail. What I do and have been doing every morning for about a month is putting this stuff that I'm going to talk about into a little cocktail along with some other things, and I'll drink wash this stuff down with this cocktail of things, and I can really tell the difference when I take this stuff as opposed to when I'm not taking it. And hey, I'm in my 50s and been hard on myself all my life. Have not had the best nutritional input. Uh, and I'm honestly just trying to practice what I preach. So I'm going to give you the benefit of some of my trial and error experience. So B6, that's a good supplement. You can get that. Now this label, Nature's Bounty, it just happens to be something that's available in local grocery stores and that kind of. So it's easy to get a hold of. Check out green tea. That is another thing that you can do. Has anti-inflammatory properties, and when you get inflammation under control, then you get swelling under control, and if you can get swelling under control, then guess what? Pain levels start to drop. Plain ground cinnamon, you can get it in capsules, so you don't have to take a teaspoon of it and like burn your tongue off when you take that. So just plain ground cinnamon is a product that you can get a hold of. Garlic tablets, they come in little capsules, and you can get a hold of this stuff, and it's not going to make your breath smell bad. You can take a couple of capsules. Then there is fish oil, and it is absolutely good. It's rich in your fat soluble vitamins, AD, I believe ADE and K, your high density lipoproteins, and those kind of things are responsible for making all kinds of things in your body. And if you have not been getting these nutritional supplements in your food, then you need to help yourself along, because if your body does not have the capability of healing itself, then you can put your spine in position all day long, and you can get things moving and in the correct position. But if your body cannot heal and reduce that inflammation on its own, then you're going to have a problem getting better from your condition. So fish oil is instrumental also in reducing those inflammatory circumstances in your joints. And then finally, not finally, but here's another product that I use. Now, I don't sell these things. I don't sell these supplements, but I've been using EAS Mileplex Light for a good number of years, and I always feel better when I use Mileplex Light. It's a protein powder, and it's also got a lot of your vitamin contents. In addition to that, wanted to mention several things. Emergen C, and you can pick that stuff up in the grocery store. It's got a ton of vitamin C in it. You need vitamin C in order to build your proteins, assemble your proteins, and get things, reduce inflammation, reduce swelling. Tons of B complexes in that little powder packet, and you'll see what I'm talking about when you check that out. You might also look into beet juice, pomegranate juice, tart cherry juice. There's a lot of products out there that are all about reducing swelling, reducing inflammation. If you can do that, then you will be more successful in getting your pain levels down. And when your pain levels drop, then swelling will go down, and that will help you tremendously with getting the pain levels under control. If you'd like to talk about any conditions that you're having issues with, you're having troubles with pain, and you just can't get it under control, give us a call at the Chiropractic Care Center, 806-793-9005. I'm Dr. Matt Roeder, and I'll be happy to talk with you.